So I continue to struggle to identify the long-term risks and benefits of buccal fat pad removal. Because one of the biggest attacks on that procedure, which my patients seem to really like, at least in the short term, is that it's going to make you gaunt as you get older. It's going to prematurely age you. And the more of these procedures that I do, the more I realize that taking out the buccal fat pad in most patients is a beautifying maneuver, not an aging maneuver. But how can we test this? How can I study this? How can I look forward in the future 20 years and say, 20 years from now, will I regret this? Fortunately, there's really no way of doing that. I mean, I have anecdotal evidence from surgeons who've been doing it for 20 years who say it doesn't age you, but that may not be enough. It's not a scientifically, rigorous way of studying this question. But what if I were to get two people, 20 years apart, the same person, and see how buccal fat pad surgery affects them both on the table and at a few months post-operatively? Would that help? If so, stay tuned and find out how doing this procedure on the same person 20 years apart can affect the outcome. Hi, this is Dr. Jonathan Zelken. I'm a board-certified plastic surgeon in Newport Beach, California. I'm a plastic surgeon of the face, breast, body, and hand. And I really have been exercising my scientific hat a lot lately as a scientist to really evaluate the influence of facial plastic surgery on aging and beautification. The buccal fat pad is a really hot topic and is the source of many of the videos that I produce on this channel. Because it is so controversial, yet in my experience, it seems to be pretty subtle and consistent. So one of the best questions about this procedure is, am I going to regret this in 20 years? Am I going to look prematurely aged as a result of plastic surgery? To which I routinely respond, no, I don't think so, because I know patients who had buccal fat pad removal 20 years ago and still look great, number one. Number two, it's a routine part of my facelift operation in patients in their 40s, 50s, and 60s. So if I didn't feel strongly about the negative cosmetic impact of the buccal body of the buccal fat pad, I wouldn't be routinely taking it out electively and also with facelift surgery. So how can I prove this? There's just honestly no way of doing it. And so, I still think that there's a chance that 20 years from now, somebody's going to be like, I wish I hadn't done that. It's going to happen. But there's got to be a better way of evaluating the impact of buccal fat pad removal on patients in their 20s versus their 40s, for example. And although, despite my teaser, I can't really do that on the same exact person because I've only been in practice for 10 years, I can look at two patients who are at least 50% identical and 20 years apart and evaluate the impact of buccal fat pad on those two patients. Here's a quick look at an adorable mother-daughter team who came in for buccal fat pad removal on the same day. As you can see here, the procedure wasn't that much different, but how big was the buccal fat pad in the mom versus the daughter? These are the left and right buccal fat pads taken from a 43-year-old mother of the next patient. And I just wanted to say that my assessment is the case was very straightforward. It took about 20 minutes. And the buccal fat pads came out fairly easily. However, I would note that they're a little bit more fragmented, almost like chewed on gum, versus a big fat jelly bean or a grape that is less loculated and fragmented. This one definitely had more of a tendency to sort of pull, but the volume, I'm going to guess, is around 4 to 5 cc's, which is on par with the average buccal fat pad that I remove in a patient indiscriminate of age. So as I sort of pass this down, you'll see that it's about 4.5 cc's for this buccal fat pad, which I would expect because I was a little bit conservative towards the end. I didn't want to hollow her out. And then if we put the two together, it brings us to pack it down a little bit, almost 9 cc's. So about 4.5 cc's per buccal fat pad with a conservative excision. I could have taken out more if I wanted to, but I definitely didn't want to. All right, so this is the daughter, half the age, and these are the buccal fat pads. And as I suggested earlier, they do look less chewed up, like chewed up bubble gum. They look more like grapes and less sort of loculated or broken up. You can see the anatomy of each buccal fat pad really well. I tell some of my patients that a buccal fat pad looks sort of like the country of Taiwan. And this is no exception. There's a temporal extension and there's a buccal body, and as it goes down, there's also a part that goes into the neck. So for the daughter's left side, the easier side, we're looking at 3.5 cc's. And for the right side, we're looking at 3.5 cc's for a total of 7. So contrary to popular belief, and I try to take out as much as I could in the daughter, contrary to popular belief, in a mother and daughter, the mother's buccal fat pads are actually bigger than her daughter's. So they don't get smaller with time. If anything, they stay the same size, and they possibly even get bigger. This is the vast majority of the buccal fat in this young woman. So if anything, the buccal fat pad actually gets a little bit bigger with time, not smaller like everybody says. It's something that I just haven't seen. The buccal fat pad is a very similar volume in all ages, all BMIs, and in fact, I've noticed that the biggest buccal fat pads I take out are usually in older individuals. The buccal fat pad becomes less kind of whole, it becomes a little bit more piecemeal, I think, with time, and it becomes less satisfying to take out, but the volume itself, as well as its color and consistency, seem to be fairly stable with time. How about the results? So even the results, as you can see, are subtle in both the mom and the daughter. I would be willing to say that the mom's results are a little bit subtler, if anything, than the daughter's, and they certainly don't make her look gaunt. A little bit thinner, sure. The daughter's results are subtle as I would expect as well, but you can still see that even though in 2 dimensions it's not a huge change, in 3 dimensions the volume change is indeed real. So as you can see here, this is not a perfect scientific study. We've got 1 and 1 paired couple. They are not 100% identical, although they do look sort of the same. They're 20 years apart, and my Cliff Note summary of this poorly constructed study that gives me some indication of buccal fat pad removal over time is that the procedure is subtle in both young patients and their older counterparts. It's not something that should or does drastically change facial appearance. Number two, the more jowling that you have and the more loose skin that you have over your lower face, the subtler the procedure is expected to be. Indeed, it's not going to make you more gaunt unless you really are pretty gaunt to begin with. Number three, the buccal fat pad is not expected to get smaller with time. In fact, I've noticed in my own experience after about 250 or 300 cases that it's typically bigger in older patients than smaller. And last but not least, again, I'm going to just reiterate, even though this is not a perfect study, I don't expect it to make you gaunt. The results are very similar in a 23-year-old versus a 43-year-old. And it's a part of my facelift practice because I think that that buccal fat pad, if anything, just adds more weight to the mobile mass of your lower face, making your cheeks bigger, making your jowls bigger, and making your marionette lines deeper. So if this is an important question of yours, there's my answer. And if it's a concern of yours, I think it's a valid concern, but these are my early findings and my opinions. If you want to learn more about buccal fat pad removal and you have your own questions that you want me to explore, I'm happy to do that on this channel. Please subscribe, turn your notifications on, and feel free to ask me any questions that you may have in the comments section below. Thank you so much.